Okay, so here today we're actually going to do a specialized treatment. This is an old surgery, so there's scar tissue. We've been working on this several treatments now. Notice the nice pink look here, fresh. We actually have been working with this, getting some great results. But it's deep tissue, it's dry tissue work that we need to do around this area to help to break down some of that scar tissue, and that's going to give our client greater range of motion, and it's going to help to open up the muscles and let them run more smoothly. So we're just going to focus on this area here, this area right here, and all of the muscles around there, and we're going to do some simple fascial stretching and some friction work, which once again we need to get lots of feedback from our client to make sure we're working within their pain tolerance. This is probably one of the most painful treatments because we are not using lotion, and in order to be successful we do need to have a friction drag on the skin, on the tissue itself. So just start by getting a comfortable position, and you start always, I like to start close, closest tissue towards the heart. Therefore we get things opened up and the blood flowing higher, and we're working down into the next tissue. Then we've already created that hyperemia. We're just going to start by following the healthy bigger muscles up here, and this is going to help us to also identify any scar tissue that we can palpate. So I'm just going to be using both of my thumbs. There's several different glides in friction work. There's like the J glide, there's cross fiber work, there's Syriacs frictions. But for our purposes today, we're just going to focus on frictions. We're going to use our thumbs, and we're going to try to get in there and break down some of the scarring that's on the tendons. So we'll work with these muscles, and then we're going to start making our way down. Is that pain?
Yeah, a little bit now.
A little bit less?
Yeah, no.
That's
yeah,
good?
It's painful. Yeah.
Okay. So we're working within our client's tolerance here. You'll see, if you look really close, when I'm going to show with my finger here how we do drag upon. It's a slow work that we do, and that is the key, is just taking your time. You see how when I go over the scar here, it's going to be white as I pass, and then it's going to get pink. See the flush, see the blood come back. And that's another thing that we're doing, is this dead or tissue that's void of much circulation, we create this fresh flow of blood into the area. Here we've got some scarring right here. Are you okay?
Yeah.
There's the drug.
Hmm?
Sound of the drug.
Yes. You can see the change though, eh? That's what's so beautiful. I love working with frictions, but you can see even the tissue itself, how it responds. Now, what happened to this gentleman is, Edward, 10 years ago? 8 years ago. When did this happen?
20 years
Oh,
ago. 20
okay.
years ago.
20 years ago.
Right, yeah.
And what happened was, this was a complete detachment of the Achilles tendon, and it had to be surgically reattached. So this is old scar tissue. And we've done now, how many treatments? 8 treatments? 8 treatments, and with our main focus of, getting more range of motion and strengthening this leg by increasing that range of motion. And we've had positive results to date. And how would you explain how would you explain the positive results, Edward?
Yeah, I mean to find the leg, both leg, and the left one, the
Yeah.
major one, is opened up quite a bit.
Mm-hmm.
Allow me to move more freely, more naturally.
Okay. All right. So it's very challenging when you are dealing with an old scar, because obviously it's something, the body is an amazing piece of equipment, and it adjusts to whatever is thrown its way. So the body has adjusted to this limitation. So now with what we're doing, structurally changing the scar tissue, there comes again change in the entire body, which affects the balance from side to side. So there's, it's a process regardless. And it takes consistency and it takes energy to keep up with it and take things to the next level. Cut.